Anxiety is a vague feeling of dread or apprehension. We can't avoid anxiety in life. Everyone experiences it at some point. Think of patients in a hospital. They go there because something's wrong. We don't see people coming to the hospital because it's a nice day outside and they felt like hanging out with us. So at a minimum, pretty much every patient, and probably their families too, will be experiencing some anxiety. Anxiety is different than fear, which is feeling afraid or threatened by an identifiable stimulus that represents danger. Anxiety does have some good points. It can motivate us to make a change or help us solve a problem. It's considered normal when the anxiety is appropriate to the situation and dissipates once it's been resolved. Were you anxious before your first exam and then felt better once it was over? If the anxiety is in excess or inappropriate to the situation or it doesn't dissipate, the person may have an anxiety disorder. Anxiety disorders are a group of conditions whose key feature is excessive anxiety with ensuing behavioral, emotional, cognitive, and physiologic responses. Those who have an anxiety disorder may have unusual behaviors such as panic without reason, unwarranted fear, or overwhelming worry to the point that it impairs their ability to function in daily life. Stress is the wear and tear that life causes on the body, and it occurs when someone has trouble handling life situations, problems, and goals. Everyone is going to handle stress differently. One may thrive in a stressful situation, while another may feel great distress. Hans Selye identified the physiologic aspects of stress, called the general adaptation syndrome, with 3 stages of stress. In the alarm reaction stage, stress stimulates the body to prepare for potential defense needs. In the resistance stage, blood is shunted to areas that are needed for defense, like the lungs and heart. In the exhaustion stage, the person has responded negatively to stress and anxiety, the body stores are depleted, and emotional components are unresolved. Hildegard Peplau developed 4 levels of anxiety. Mild anxiety is the sensation that something is different and warrants special attention. Sensory stimulation increases and helps to focus attention to learn, solve problems, think, act, feel, and protect themselves. It motivates a person to make changes. Physiologic responses include a wide perceptual field, sharpened senses, increased motivation, effective problem solving, increased learning ability, and irritability. Symptoms we may see are restlessness, fidgeting, GI butterflies, difficulty sleeping, and hypersensitivity to noise. With moderate anxiety, it's a disturbing feeling that something is definitely wrong. The person becomes nervous or agitated. They can still process information and solve problems and learn, but they may need some help. They may have trouble concentrating and will have to be redirected to the topic. Physiologic responses include perceptual field narrowed to the immediate task. They're selectively attentive, can't connect thoughts or events independently, and there's an increased use of automatisms. Symptoms we may see are muscle tension, diaphoresis, pounding pulse, headache, dry mouth, a high-pitched voice, faster rate of speech, GI upset, and frequent urination. With severe anxiety, the more primal survival skills take over. Defensive responses ensue, and cognitive skills decrease significantly. The person has trouble thinking and reasoning. Muscles tighten, and vital signs increase. They may pace or be irritable and angry. Pupils enlarge to let in more light. Physiologic responses include the perceptual field reduced to one detail or scattered details. They can't complete tasks, solve problems, or learn effectively. Their behavior is focused on anxiety relief, and it's usually ineffective. They don't respond to redirection, feel awe, dread, or horror. They may cry and engage in ritualistic behavior. Symptoms include a severe headache, nausea, vomiting, diarrhea, trembling, rigid stance, vertigo. They may look pale, have tachycardia, and complain of chest pain. With panic level, there is great emotional fear as well as physiologic discomfort. Physiological responses, the perceptual field is reduced to focus only on self. They can't process any environmental stimuli, have distorted perceptions, loss of rational thought, they don't recognize potential danger, can't communicate verbally, they may have delusions and hallucinations, and they may be suicidal. Symptoms: they may bolt and run, they may be totally immobile or mute, have dilated pupils, increased blood pressure and pulse, fight, flight, or freeze. As nurses, we're going to encounter patients and families feeling anxiety, and we may see them in any setting in nursing. Assessing the person's level of anxiety helps us determine which interventions will be most effective for that patient or family member. With mild anxiety, it's a good time for the patient to learn and solve problems, while with moderate anxiety, we'll need to make sure the patient is following what we're saying and may need to redirect them to the topic. Use short, simple, and easy to understand sentences to help ensure understanding. Once the patient's anxiety level has progressed to severe or panic, we need to help the patient lower their level of anxiety before we can do anything else. It's helpful to use a low, calm, and soothing voice when talking to the patient, and walking with them can help if they feel as though they can't sit still. You may need to help them take deep breaths, which can also help lower anxiety. If the patient has panic level anxiety, be mindful of safety. The patient is no longer able to think rationally or to correctly perceive harm. Take them to a quiet, non-stimulating place and talk to them to help them calm down. Reassure them that they're in a safe place and that you're going to stay with them. Panic level anxiety doesn't last long, usually anywhere from about 5 to 30 minutes. Table 14.2 has a list of anxiolytics we can use for anxiety. Most of them are benzodiazepines, which we need to be careful with. Remember that benzos have a high potential for abuse and dependence. Benzos were intended for short-term use, 4 to 6 weeks, rather than the long-term use we frequently see. The benzos we most commonly see, and the ones to know for this class, are diazepam or Valium, alprazolam or Xanax, lorazepam or Ativan, and clonazepam or Klonopin. Valium is the fastest acting, with Ativan and Klonopin the slowest. Side effects include dizziness, clumsiness, sedation, headache, blurred vision, dry mouth, constipation, and sexual dysfunction. Table 14.3 has another list of medications for anxiety, including more non-benzo anxiolytics. Other meds to know for anxiety are buspirone or Buspar, clonidine or Catapres, fluoxetine or Prozac, hydroxyzine pamoate and hydroxyzine hydrochloride, which are Vistaril and Atarax, and sertraline or Zoloft. Anxiety disorders are diagnosed when anxiety no longer functions as a motivation for change or a danger signal, but is instead chronic and results in maladaptive behavior. Some types of anxiety disorders include agoraphobia, panic disorder, social phobia, and generalized anxiety disorder, or GAD. Some related disorders include selective mutism, which is diagnosed in kids who are able to speak but don't in social situations. Substance or medication-induced anxiety disorder occurs when the anxiety comes from medication, drug abuse, or a toxin. Separation anxiety disorder is excessive anxiety when leaving home or a caregiver and is diagnosed when it is no longer developmentally appropriate and before the person is 18 years old. Anxiety disorders are the most common psychiatric disorders in the United States. It occurs in nearly 1 out of every 4 people. It's most prevalent in women, those under 45 years old, those who are divorced or separated, and those of a lower socioeconomic status. We don't always know exactly what causes people to have an anxiety disorder, but there are theories. Genetic theory states that anxiety may have an inherited component. If a patient has a first-degree family member, like a parent or a sibling, that has anxiety, they are more likely to be anxious themselves. Neurochemical theories believe that GABA is dysfunctional in anxiety disorders rather than reducing anxiety. Serotonin may also have a role in anxiety disorders such as OCD, panic disorder, and GAD. With intrapsychic or psychoanalytic theories, Freud believed that a person's innate anxiety was a stimulus for behavior and that people use defense mechanisms to control their awareness of anxiety and reduce it. Be sure to review defense mechanisms that are found in Table 3.1. The interpersonal theories of Sullivan saw anxiety as coming from problems in interpersonal relationships. Peplau developed the 4 levels of anxiety, nursing interventions, and interpersonal communication techniques, which are still used today. The behavioral theory feels that anxiety is learned through experiences and that people can change through new experiences. Every culture varies on how they express and deal with anxiety. Those from an Asian culture may complain of somatic symptoms like headaches or nausea, while some Hispanic cultures may be diagnosed with susto during times of high anxiety. The symptoms of susto are believed to come from supernatural spirits or bad air. Treatment for anxiety involves both medication and therapy. We already talked about medication, so we'll discuss therapy now. CBT, or cognitive behavioral therapy, is the most common therapy used to treat anxiety. Positive reframing turns negative messages into positive ones. Instead of saying, "I'm a bad person, anyone could do this," the message would be changed to, "I've already gotten up this morning, gotten dressed, and made my bed." Decatastrophizing uses questions to more realistically appraise the situation. The therapist will ask questions like, "What's the worst thing that could happen? Is that likely to happen? Could you survive that?" in order to help the patient look at the situation differently and know they will be okay. Assertiveness training helps the person get more control over life situations by teaching them to negotiate interpersonal situations and gain self-assurance. Anxiety that starts late in life is usually associated with another disorder like depression, dementia, or medication toxicity. The most common are agoraphobia and GAD. Treatment is usually SSRIs, started at a lower dose to ensure the medication is well tolerated. Typically, anxiety is seen as something negative. However, it's simply a warning sign that the person is not dealing with stress effectively. Stress is not something we have only when we encounter a problem in life. There are plenty of positive life experiences that are positive but cause stress. Leaving home for college, getting married, having a baby, changing jobs, going to nursing school, and so forth. Stress management is key to being mentally healthy. Medication can help with excessive anxiety, but it doesn't solve the problem completely. We need to learn to manage stress and anxiety. Some tips for managing stress include having a positive attitude, learning to talk about and express feelings, accepting we can't control everything, setting realistic goals, exercising regularly, eating a balanced diet, and getting enough sleep. Panic disorder is composed of discrete episodes of panic attacks, 15 to 30 minutes of rapid, intense, escalating anxiety in which the person experiences great emotional fear as well as physiologic discomfort. Symptoms of a panic attack include sweating, palpitations, chest pain, tremors, and shortness of breath. Panic disorder is diagnosed when the person has recurrent, unexpected panic attacks that are followed by at least 1 month of persistent worry about future attacks. Onset of panic disorder is usually in the late teens to mid-30s. Panic attacks can lead to avoidance behavior, where the person avoids situations or places they may fear may cause another panic attack. Primary gain is an attempt to relieve the anxiety by staying home where they feel safe, while secondary gain is the attention they get from others because of their behavior. There's an increased risk of suicide for those with panic disorder. Treatment for panic disorder includes CBT and medications, such as benzos and SSRIs. Sometimes antihypertensives like clonidine and propranolol are used to help calm the body down. We can teach the patient deep breathing techniques and other relaxation techniques to help them learn to manage their symptoms. Assessment can include using the Hamilton Rating Scale for Anxiety, which is in your book in box 14.1. The Hamilton scale gives a number to help give the psychiatrist and nurses an idea where the patient is. Look at the patient's history to discover if they frequently feel anxious or have had panic attacks before. Watch their motor behavior and assess for automatisms like tapping fingers and toes or twisting their hair. Listen to their speech. Are they speaking faster or louder than is appropriate? How does their general appearance look? When asking about mood, the patient may report feeling anxious, sad, depressed, or tense. They may be fearful at times or appear distressed. They may say they feel detached from themselves during a panic attack, depersonalization, or that they feel that things aren't real, derealization. During a panic attack, the patient feels overwhelmed, that they have lost control, or that they're dying. They may feel as though they want to kill themselves. They can no longer think rationally, and their thoughts are disorganized. When not having a panic attack, they may be preoccupied and worried about having another one. The patient may be confused and disoriented. They aren't able to take in environmental cues accurately and may panic and run or try to fight. Patients may believe they're helpless and have no control over their disorder. They may blame themselves and have a negative view of their life. Roles and relationships can change, especially if they're avoiding people or places they associate with panic attacks. They can have trouble sleeping and eating and may spend hours in bed. Nursing diagnoses can include anxiety, ineffective coping, powerlessness, disturbed sleep pattern, and ineffective role performance. Interventions need to focus on safety and comfort. The patient may need a calm, quiet place to reduce anxiety and give them some privacy. Stay with the patient and talk to them in a calm, soothing voice. Remember that your statements need to be short and direct. When the patient is calm, teach them anxiety management techniques such as deep breathing, guided imagery, or progressive relaxation. Have the patient practice these techniques while they're calm so they can use them when they notice their anxiety starting to increase. As always, education is important. The patient needs to learn how to manage stress and stress-provoking situations. Teach them about their medication and how they should be taken. We see a lot of PRN medication for anxiety. Teach them the benefits of exercise for anxiety disorders. Evaluate the patient's understanding of their medication and coping techniques. A phobia is an intense, illogical, and persistent fear of a specific object or social situation that causes extreme distress and interferes with normal functioning. The reaction is out of proportion to the situation or circumstance. Those with phobias may have anticipatory anxiety when thinking they may encounter their phobia and engage in avoidance behavior. There are three categories of phobias: agoraphobia, specific phobia, and social anxiety phobia. Specific phobias also have subcategories: natural environment, blood injection, situational, animal, and other. Phobias usually happen in childhood or adolescence. Treatment for phobias is behavioral therapy, which includes systematic desensitization, flooding, positive reframing, and assertiveness training. With generalized anxiety disorder, or GAD, the person worries excessively or feels anxious at least 50% of the time for 6 months or more. Symptoms include uneasiness, irritability, muscle tension, fatigue, trouble sleeping, and trouble thinking. GAD is a chronic condition and is treated with buspirone or Buspar and SSRIs or SNRIs. It can be difficult to work with those who have anxiety. As a nurse, you need to understand how anxiety works and why your patient can't simply calm down. You may feel anxious yourself. Don't try to fix the patient's problems, but do teach them how to manage the anxiety and stress they feel. You may find those techniques helpful in your own life. Nursing is a stressful job.